All right, I think we'll get started with the housekeeping items. Good morning or good afternoon, everyone. Thanks for joining us. My name is Megan Dotson, and I'm the program manager for the National American Indian and Alaska Native Mental Health Technology Transfer Center. And today we're bringing you the 988 National Crisis Number, a tribal outreach approach. So we're excited to be doing this today with these fine folks. This is our network, and we're part of this big network here. We have a national coordinating office, a national Hispanic and Latino office, and then ours, along with these 10 other regional centers across the country. We all provide training and TA. And then SAMHSA is our funder. So, of course, the disclaimer that we have to read is that our organization is supported by a grant from SAMHSA. And so the contents of this event are the creation of the presenters, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian and Alaska Native, MHTTC. Following today's webinar, you'll actually get a recording for the link and then any handouts we may have, so you have further information. And it'll be sent to the email that you registered with today. And then we'll also have a GIPRA survey that we'll have you fill out at the end. We do like to take a moment of silence for this land acknowledgement, so we can thank the members of our staff who created this and be respectful of the earth. Okay, thank you. And we'll have this included in the handout as well. So today's speakers, I was going to have each one of you introduce yourself. Ray, if you want to just tell us a little bit about your work and yourself, I'll move the forward screen to the next person when you're done.
Okay, I think, good morning, everyone. And I'm Navajo. It's a primary thing for everyone to know. And I've been blessed to have a extensive experience in Indian country across the United States in my work as a preventionist as well as a clinician. So I'll leave it at that. From New Mexico, Arizona. Thank you.
Thanks, Ray. Stephanie, you want to go next?
Good morning, everybody. Thanks for having us. I'm Steph Poston. I'm from the Pueblo of Sandia. It's a tribe immediately north of Albuquerque, New Mexico. I worked for my tribe for a number of years, including the being the inaugural health director of my tribe. I've since started my own business since 2004, had my own PR marketing company specializing in working with tribes and indigenous populations, not only here in the state of New Mexico, but throughout Indian country. This weekend, we just celebrated as a chairwoman of the Southwestern Association for Indian Arts, or Indian Market. We just had our 100th anniversary in Santa Fe, and it was quite the experience. So just glad to be here and moving forward, looking forward to the presentation today. Thank you.
Thank you. And Cindy.
Good morning, everyone. Thanks for having us here. My name is Cindy Salkeman. I am the CEO and owner of SBS Evaluation and Program Development Specialist and Evaluation Technical Assistance and Training Firm here in New Mexico. Recently, I'm also one of the co-founders of and the current director of the New Mexico Tribal Behavioral Health Providers Association. I've been working tribal communities for over 20 years now here in New Mexico, and prior to that, a lot of experience in international health. Currently work in a variety of states providing program evaluation and training as well. Extremely happy to be sharing information about 988 and hopefully answering any questions that come up. And it's been a great experience working with this team. There's a group of us doing a lot of work with 988, and so hopefully will provide some clarification and some answers if needed. Thank you.
Thank you, Cindy. Okay, so with that, I'm going to stop sharing my screen and we'll go with the next presentation.
So I think I'm up and I can share my screen. So part of the 988 New Mexico Tribal Outreach, we're obviously teaming with the New Mexico Human Services Department, 988, along with my company, Poston and Associates. So folks, I just always like to say thank you first for even wanting to listen to the presentation, be a part of it, or any work that you all do in working on behavioral health, mental wellness, any of that. It's really important work, and really appreciative of everybody who does that work. On my team for the 988 campaign, it's myself, Steph Poston. I am from the Pueblo of Sandia, Raydaw, Navajo. Holly Patterson is, and Ray will chime in. Holly Patterson is Navajo. She's our social media and graphic design. I oversee the overall creative, but she makes come to life whatever we have on postcards or billboards or any of those collateral pieces. And then I have Sunshine Eaton from the Pueblo of Tesuque, who has helped me tremendously with the Northern Pueblos and the entities, tribal serving entities up in Northern New Mexico. And then the other member of my team is Joanne Padilla. She serves as the project coordinator, supporting the team and getting the word out. So for me, because our state is, the largest tribal population is Navajo, so to have that representation. And then there are 20 Pueblos here in the state of New Mexico to make sure that we had that covered. We also pay special attention to the Mescalero Apache and the Jicarilla Apache nations. When we started the campaign, we really wanted to make sure this was kind of, Ray and I started to work on the COVID-19 crisis hotline. So we knew that worked. So when the COVID-19 crisis hotline, when we were working on that to work with tribes, the tribal population in the state of New Mexico is approximately 10%. And so when we tracked the calls, tribal people, indigenous people were 31% of the calls to the COVID-19 crisis hotline. So we felt like that worked, and how can we transfer some of what worked onto the 988 campaign? And to do that, we centered around what are our core values for this campaign. We want to make sure we're respectful, make sure that we're patient, make sure that we are resourceful, that we present in a way that's hopeful, that we show compassion to those that we are engaging with, and that we really focus on the wellness aspect, right? So those were in developing our campaign, these are the core values in which we operate from. So the campaign goals were real straightforward. First and foremost, before 988 launched live on July 16th, we're in a little bit of a tricky spot in terms of pushing out 988, knowing that it was not live until July 16th, but we just didn't want it to go live and all of a sudden we have all this media. We wanted people to know that starting July 16th, they could access this resource, this tool. So our first thing was to let people know, raise that awareness. And a big thing in Indian country, I think we've all been working toward, is normalizing asking for help and support. And the third thing is providing access to behavioral health tools. So those were our overarching goals for the 988 campaign and designing this outreach. So who is our audience? We broke it up into 3 categories. It was the tribal leaders at government to government policy. There's a 988 work group in our state who works on that. There was actually a tribal consultation with the tribes that happened on June 24th about specifically 988. And there's one coming up this fall on 988. So with that, we left that to state of New Mexico leadership and the tribes to really do that government to government relationships. Ray and my team focused on the service providers and the consumers of 988 and designed our outreach around that. And while also supporting the tribal leader aspect any way we could. So what was our approach? Like pre-launch meant pre-July 16th. It was a lot of high touch, direct outreach, community engagement, had a strong social media outreach. We did some billboarding, and we gave out a lot of postcards, and our postcards kind of looked something like this, and let people know the number was coming. And we gave away flyers. We did some tabling. And then we were the only group in our state who had a soft launch for tribes and service providers. So we had the soft launch on July 15th. And part of that soft launch was to, here's all the material, here's all the collateral material, here's the postcards, here's yard signs, which look like this. I don't know if you can see it through. Yeah, it's hard to see. We had yard signs, we had backpacks, we had hand sanitizers. And part of that was to invite the service providers so that they could redistribute at their tabling events. And then we also took the feedback that they had to refine our next wave of collateral material. And we had some great feedback. And as a matter of fact, we keep building our strategy around that feedback that we did receive. So after July 16th, we have more billboards out there. We have radio ads. We've refined the collateral material that I just discussed. Lots of folks that we reached out to. I mean, this is just a short list. You know, we've been asked by the state of New Mexico, like how much outreach. So the project coordinator about a week ago inputted like 100 entries into tabling and all the outreach we did. And I know that we're missing a lot, but we know it's that high touch, that trust with tribal service providers and others that really makes a difference. So one of the things is Cindy's part of our team, Cindy Sockman, and you'll hear from her, but we, in order to kind of work collectively as a team, Ray and I are in charge of getting the word out, letting folks know 988 is there. Cindy then can come in and give them more detail about how to enhance their own programs and plug into 988. So she'll talk about that more. So we make sure that people know that they can go to Cindy for that 988 training and learn more about what's available through 988 and how tribes might get more support. So here's just some of the direct outreach. You see that we were in community, giving the postcards, putting up the signs. We meet, some of the tribes here in our state are still closed. So we still have to meet people at their tribal entrance, their reservation boundaries. That's starting to be less now, but we're still out there giving them the information they need. And tribes have been really responsive and helpful, and but it's going to take a long time, just like 911 did. 988 is going to take the same sort of effort. Here are some of our billboards. This one is at the San Felipe Casino. It gives, I mean, they were a great partner. So we circulate inside their ads. And so this is one of the most coveted billboards between Albuquerque and Santa Fe, and they're a good partner. They added 988 into their rotation of advertising. And then this 988 is in Albuquerque, near a part of Albuquerque that has a high Native population. So we not only have the tribes itself, we also know we have a high population of Native people living in Albuquerque, Santa Fe, Farmington, and other urban settings. So we've studied that and want to make sure we reach out to them accordingly. And here, so all our stuff is housed on the 988 website. So if you want, go under this website, 988nm.org, and go to resources, Native American resources. It has all our billboards, our postcards. People can download it. There's a video. There's a radio ad. There's everything there, including these amazing backdrops, Zoom backdrops that you all can take a look at. You can, to help us get the word out. And they've actually been really popular. And Ray, that was Ray's idea to do that. And since you start to notice other groups having the 988 backdrops as a simple tool to show alliance and support of the 988 and the possibilities of that support that's needed in tribal communities. So the request at our launch was to get information out, encourage people to follow us on our socials. We now have a TikTok as well, and to get feedback on the survey, which we did. Approximately 60 people came to our pre-launch, and we got about 38 surveys back. So that was a really great response. So here's our, if you're looking for us on Instagram, this is what we look like on Instagram, and this is what we look like on Facebook. So just the group, like, why are we even here? We're here for the kids so that they have the tools and support they need, and just the lessons that we learned from our grandparents and our ancestors. This is actually a picture of my own grandparents, Pete and Concepcion Avila, and I miss them so much, and they guided me toward this work, and I hope they're happy and proud of the work that we do to support tribal communities. So with that, I'd like to ask Ray to add. He's been an amazing partner. He always has great insight on how we reach tribal communities. He has such great trust with the tribes. So with that, I will turn it over to Ray. Mr. Ray Daw.
Was there another slide after that? Or was that it?
That one's it.
Okay, cool. Thank you. Well, it's not too often that we get great partners and projects that we do. And certainly, Steve and Megan with the National Center have been really, really great partners. And Cindy and Stephanie. There's a state, as we're talking right now, there's a statewide Native 988 call occurring right now. And the group is having a discussion about not only the outreach part of our campaign, but also how we're working on beginning to establish crisis teams across Native country. And I think Cindy will talk to that also. But I think I've been blessed, and Steph also has been, we've been blessed, Cindy, Stephanie, and I, that we have worked across almost all of Native country in New Mexico. And from that, have developed over the decades, for me at least, some really great relationships across the Native statewide system. Narrowed down to the Navajo side, we have 110 Navajo communities within the Navajo Nation. And of that 110, over half are within the New Mexico side. These are distinct communities. And I've been blessed also within my people to have had an extensive experience working with the Navajo communities in my region. I know personally, I've visited all the Navajo communities on the New Mexico side. I've been there, I've been to chapter meetings, know majority of the leadership on the Navajo Nation side. So it's been not too difficult taking the work that we're doing and talking to, embedding in place within the Navajo Nation, the work that we're doing, but also having had extensive experience with the towns in Farmington and Gallup and Grants, Zuni Pueblo, where I have relatives, and friends and family, Laguna and Acoma, to be able to take this message and make it meaningful to our people. And that's the joy of it, because like Stephanie said, this is for our kids and our families. There are tribes in our state who have very high suicide death numbers and attempts and ideation. We know that, and so and we I don't know of any Native who has not experienced a suicide death in the family as well. So it's what makes it really personal for us to do the best we can and put in the kind of time that, like Stephanie did this weekend, 3 days of work, Friday, Saturday, and Sunday, probably 10 or 12-hour days, putting out information to our people in Santa Fe. And I really respect that. Her and the team we have really have to have their hearts into this. But the second step here is to be alert. With Cindy does this really well. She just advocates for our people at the state level really well. She's able to pull out resources that we can use in Indian country, I think. And I honor Cindy for that. And a number of Native liaisons and advocates within the state system. You guys all have value and mean so much to all of us in the communities. So I wanted to mention broadly some of the work that we're doing in New Mexico, why it's important, and why we felt it would be good to share this knowledge with our Native friends and allies across Indian country, the United States. But this is an opportunity for us to do something meaningful, I think, with our young people especially, and with each other, so that we can begin to see some more significant impact than what I've seen over the last, across my career with suicide deaths and ideation. So with that, I'll zip it and pass it on to Cindy.
But just before we pass it on to Cindy, I just also want to say that, I mean, all of you might have witnessed it, like it made national news with the Gallup ceremonial and the parade. And, you know, Ray was right in the middle and supporting, boots on the ground, getting material out, working with the state closely to be available to support those families and people that were impacted by the trauma of that vehicle that could have really been a disaster. Thankfully, people were hurt, but it was nothing life-threatening. But the emotional stress that it put on people, and that, you know, we were able to pivot and get boots on the ground and, you know, just raise trust with the community just made such a huge difference. So number one, I appreciate that, Ray, and number two, more people should know about that effort.
Mm-hmm. I want to mention that for me, you know, and the work we do within our communities around treatment, intervention, and prevention. Prevention, treatment, and intervention. They're all one continuum, and they're all one continuum. And with crisis response, we did a 10-day crisis response in Gallup across the community, and all of our partners in Gallup understood the value of the 988 message, and it's made it easier to pass on the word. We had counselors walking around during a parade one morning wearing 988 t-shirts, 988 number on their t-shirts as part of our crisis response. And that's how a number of us understand prevention as part of the continuum, not just a separate thing that happens periodically or sporadically, but the challenges that weave it into all of what we do across all aspects of behavioral health work that we do. So I wanted to share that. Thank you. Go ahead.
Okay, thank you so much, everyone, for sharing. I do want to start with the acknowledging what took place in Gallup. I've worked in Gallup for about 20 years, and I got a call that Friday, and I started pretty much leaning on a lot of the people that I know that would support. And I've got to say, you know, Ray and Steph and her team really took off with the sharing of the 988. Was able to, with this, along with the city, we coordinated healing ceremonies We coordinated, we moved a lot of the state folks into action. And again, in that role of director of the Behavioral Health Providers Association, the Tribal Behavioral Health Providers Association, a lot of aspects moved. And because I also work with the university, we were able to get counselors, were able to partner with and bring in about 16 therapists, tribal therapists that volunteered their time to hold a healing circle. And again, all of this work, all of this crisis response is really a team effort. And so it's I'm going to just echo Ray's words, in that we've been very blessed and fortunate to have worked in so many areas and with so many tribal communities and so many different stakeholders throughout the state to be able to make something like that happen. That was a true coordination. By the time the secretary heard about the event, they sent out some major recruits too that helped out with therapy, and even a therapy dog to walk around the parade. So, I think, again, all of these efforts are joint, and we work really well together. And I think in general is spreading the word about the services that are out there and partnering to make sure that everyone receives the services that are needed. So again, I'm Cindy Sockerman. Thank you for having me here. I'm going to give a real quick overview of some of the more extensive outreach that's going on. And again, we all have pieces of this entire 988 crisis movement. And, Steph talked about the outreach that they're doing, and their outreach is massive because it's really about awareness, right? Raising awareness about this initiative. And so for my piece, I had originally asked to provide a one hour overview of 988, more of a Zoom webinar like this, where people can ask questions and get clarification. And this was tribal specific. And in addition to that, I'm scheduling 4-hour on-site presentations. Those presentations are extremely interactive, and I'm holding them with tribal government officials. I'm holding them with program directors and with community members. So the presentations can have 80 to 100 people. They can have 5 to 10 people. It really varies. And, going along in terms of, we all share very common values, and some of those include the respect of our community members, acknowledging where they are at and the knowledge that they bring to whatever the topic is that we're presenting on. And so for me, it was really important to meet the communities where they were at and acknowledge the strength and the capacity that they currently have. By doing that, these 4-hour on-site presentations really look at the readiness of that specific community and the level of crisis capacity that they already have. One of the things that we found out was that there are some tribal communities that are pretty advanced when it comes to mobile crisis response, including having mobile crisis teams, vehicles that go out, and they've done it for 20 plus years. And, that's not very common in our state in general. So they were pretty advanced. Now they still need a couple of components and some capacity building and other areas to kind of meet what the crisis now model is going to look like. But again, everyone's at different levels. And so we wanted to meet the communities where they were at. Right now, currently, I was a single team member. So unlike Steph, which I love that she has a whole team because I see them all the time on TikTok and Facebook at building awareness. It's been me so far, and my team has now grown. We're now going to have 3 people that are doing some of these presentations. And a big part of that is the request has been enormous. So the overview will cover, what is 988? I know we started talking, we jumped into like the 988 building awareness, but what is 988? And I'll go through that in the presentation. I also cover, what's the difference between 988 and 911? And what is a behavioral health crisis? What are some of the reasons that people can use 988? provide an overview of the Crisis Now system, or the model. You'll hear a lot about the model, and I'll show a slide about what the model looks like. But as Steph mentioned, this entire model, in order for it to be implemented, is going to take a very long time. It's going to take years. And, you know, and in our state, we're starting. And so I think one of the key things that I want to make sure that we get across is 988, the call center, the system for texting and chatting and calling to receive services and to be able to de-escalate. That's our key process right now. That's our key focus. Later on, we'll talk about the other portions of that Crisis Now system, that those are more in depth and they're not completely and fully developed in our state right now. And so I just kind of want to pinpoint that, because I've heard there are a lot of concerns about, you know, availability of mobile crisis teams, availability of crisis triage centers, but we're not there yet. This is where we're wanting to go. And so I just wanted to reiterate that. We also talk a little bit about data privacy, an overview of what mobile crisis teams are and where we want them to go, what are the regulations for them. Same overview about a crisis triage center. And then we cover also some of the known limitations. There are a lot of known limitations and challenges in terms of 988 for tribal communities. And then in terms of the 4-hour on-site, I really work with the community itself to come up with a crisis response plan that would work for them, to consider some of the things that we might not think about in the beginning when we're thinking about developing a crisis system in a tribal community. And part of that is we're looking at the, you know, who's needed, who we need to hire, what are the licensures that are needed. You know, we start focusing on all of those things, but there's all of the tribal and ceremonial and limitations for gender and limitations for hours that might come into play. Now, when we're thinking about crisis response, we kind of need to combine all of that together. So we bring up discussions about that, and we try to come up with a plan of what would work in that specific community. And in addition to that, we have conversations about how the 988 system in general can support the tribal community wherever they are at. So that is a little bit of the outreach, specific outreach that's taking place now. So what is 988? 988 is a 3-digit number that is going to be the counterpart to 911. And a big portion of this is really 988 is for behavioral health emergencies. That can include a variety of topics that we'll start talking about and sharing in a little bit. It's really a way to get behavioral health assistance, be able to have someone help you de-escalate, hear you out, and kind of bring you back down, if possible, through a phone call. And we're trying to make sure that it's a very easy number to remember, just as 911 is. 911 is not going anywhere though, so I just want to reiterate that. And what falls under a behavioral health crisis? So a lot of times that includes thoughts of suicide, harm to self, harm to others. It could include anxiety, depression, isolation. We know that the pandemic brought a lot of isolation. It also brought a lot of depression because of loss of jobs, loss of family members, loss of employment. We've had a lot of fires in our state that included a lot of trauma as well. And so any of those reasons, any type of emotional distress, a situation in which you cannot de-escalate yourself or find resources for yourself would be a really good reason to try to call. Substance use, of course, is another big one. Or if you're a family member of someone that is using substances and you have reached your tipping point, you would be able to call 988 and receive some of those services. If you're worried about a loved one, if you're worried about, someone that, a youth that might be in crisis, you might be worried about an elder. You can call and get resources for them and yourself. So what might a behavioral health crisis look like? There's been a lot of loss of job, like I mentioned. There's been a lot of feelings of loneliness and isolation. A lot of I've heard a lot of teenagers talking about isolation, elders talking about isolation. There's also been a loss of family members. And so there's depression, there's anxiety about what to do with life and how to support yourself and your family. Again, I mentioned the trauma related to the fires. There's a lot of folks dealing with substance use and family members that are unfortunately have addiction to substance use, and that brings a toll on the family member. And so that family member can call as well. I've heard a lot of folks also talking about running out of their psychiatric medications. And although the number will not provide you psychiatric medications, it can help you with coping skills to de-escalate you and ground you and help you with some of the impact that you might be going through until your next appointment. We hear a lot of youth talking about suicidal ideation due to breaking up, loss of relationships or loss of friendships. Same thing with adults in terms of loss of relationships or divorces. And so any of these reasons, and of course, this is a limited list, the amount of reasons folks can call is massive. And so please know that if you feel like you need some assistance, behavioral health related assistance, de-escalation and some support, or even someone to listen to you, feel free to call, text, or chat 988. 911 diversions to 988. So a big part of why this is a national effort, by the way, and I know that at the national level, suicide prevention is their main focus. In New Mexico, that has been expanded. It's really all behavioral health situations and substance use, in addition to trying to decrease suicidality. And so one of the big things that we see in our state, unfortunately, is that we have a lot of folks with mental health crises, mental health situations that are incarcerated, and they're not getting the help that they need. They're really cycling the system. And so in order to decrease some of the mental health illness seen in the detention centers, we're hoping that 988 early intervention would be ideal in assisting folks staying out of the detention centers. So that's one of our main goals. And then the other one is, we've all really seen, and we're aware of how law enforcement is normally a trigger for a lot of colored communities. And so we've also seen a lot of law enforcement trying to de-escalate a behavioral health situation or a situation through loud voices, large surrounding people, large groups of law enforcement officers surrounding people, because they're not necessarily trained in behavioral health. And this doesn't apply to all law enforcement, because some of them have been trained, and I applaud the fact that they have sought out some training on de-escalation and behavioral health. But the whole focus of 988 really is to have an approach where we have behavioral health professionals that are attending to the situation, to a behavioral health crisis situation, to try to de-escalate that. Additionally, besides the ethical component, which is a key component, there is a fiscal responsibility component to all of this. It's extremely expensive to have hospitalization, ambulances, emergency departments, trying to handle a behavioral health situation when we know that not all medical providers are trained in behavioral health, and the little knowledge that they get in medical school is limited to one day. So a lot of the times they're not necessarily comfortable handling a behavioral health crisis or behavioral health situation. And we have folks that are trained to do that. All right, so now how is 988 different from 911? So a big part is that 911 is not changing, right? That's not going away. That's still going to dispatch emergency medical services, paramedics, fire departments, and police if needed. And 988 will focus on that behavioral health component. That's going to come up with a lot of positive outcomes. And that includes freeing time of law enforcement officers to do the job that they were trained to do. It also allows emergency departments to not be completely overwhelmed with a lot of folks that are there for behavioral health crises that can be de-escalated earlier on. Another big component for the client themselves that is calling 988 is really to get immediate relief over the phone or through text, and making it simple enough that folks would be able to dial 988 or text 988 or chat and be able to get the services and resources that they need immediately. The other big component is this picture that you see down below here. 988 crisis, and now we're talking about the crisis system, those folks that are going to be going out. But in general, is really to have these behavioral health professionals that are trained on de-escalation, that are empathetic to the situation, that understand mental health, come down to the level of where the person is at the moment to be able to help them out. And in addition to that, to be able to go out to them where they're at and meet them in their either place of home or on the street, at a park, at a friend's house, wherever it is that they're needed in order to get the services that they need. Now, part of what I was talking about just a second ago is this overview of the 988 Crisis Now system. This is a new system, and this is the system that I've been talking about that will take years to develop, to fully develop in our state. The biggest piece that we're talking about right now is here's the person in crisis. The person in crisis calls 988, which is the 988 number that we are trying to raise awareness for. That if the person is in need of 911, so those emergency services, 988 will call 911, connect the person, and the same thing will happen. Law enforcement, ambulance, fire will still come out. Same outcomes, inpatient, emergency department, or detention center will be the outcome of that. But if the person can be de-escalated, and about 80% of calls, behavioral health calls, are resolved during that phone call. This is very important to note because we have situations that kind of get past that original point where it becomes completely overwhelming to people. But if people start getting their situations resolved within that first call, that's going to lead to super positive outcomes. And so just know 80% of the calls are resolved on that call, during that call. The other piece to that is that we are now developing some mobile crisis teams. We are going to have 4 pilots, 4 mobile crisis teams. That's not a lot. That's 4 mobile crisis team pilots that are going to be developed hopefully by December of this year. Mobile crisis teams go out when the call is not resolved over the phone. The call center can dispatch a mobile crisis team if a mobile crisis team exists. So once those teams are developed, the crisis center can call the mobile crisis teams, dispatch them out to the community where the person in crisis is. Now that mobile crisis team can resolve 70% of those in-person visits because they're out in the field. Now in our state, the goal is that we will have enough mobile crisis teams over the course of years upcoming, where the mobile crisis teams should be able to reach a person in no more than 90 minutes. That's the goal in our state. That means that we would need to develop a lot of mobile crisis teams in order to reach our goal. And so again, that's why it's going to take some time. We're also working on developing some crisis triage centers. We currently have 4 in our state. We have 3 in our state. A 4th one's developing and being built currently. We have one in Santa Fe, one in Las Cruces, one in Bernalillo, and then one is being developed by UNM. And then we also have, I'll end it there for right now. All of them act differently, but really it's a place where if someone cannot be de-escalated over the phone or through a mobile crisis team, where they can go to de-escalate to receive either medication-assisted treatment, treatment for psychosis, where they would be able to have someone there for them to separate them from the situation maybe. That's what the crisis triage center would be. They normally have medical staff available on site. They also have behavioral health and case management availability. In our state, they all work a little bit differently though. And so I want you to kind of keep that in mind. And all crisis triage centers do work a little bit differently. Some of them are open 24/7. Others are open longer hours. So they might close at 10 o'clock at night. Some of them are open on the weekends. So you might want to look into the crisis triage center that might be available in your area before showing up. Some of them allow walk-ins. So if someone's in the middle of a crisis and they just want to drive themselves to a crisis triage center, they can, but some of them do not. Some of them act by referral only. So you have to kind of be familiar with what your crisis triage center offers. And then the last component of the Crisis Now model is community-based stabilization. So that's after the crisis. So once you know that someone has gone through a crisis, is that follow through to make sure that they are stabilized, that they have the resources, that they are connected to the services that they need. That could include outpatient services, it could include counseling, it could include inpatient services, it could include a primary care visit. So just making sure that they have, it could include a support group. So just making sure that they have the services that they need. Now in New Mexico right now, we have an RFA that's coming out, and that's going to include mobile crisis teams, crisis triage centers, and a possibility of a component with a tribal crisis line if folks apply for that. So those 3 RFAs coming out shortly. So that kind of tells you a little bit about the system. And then who can call 988? Really anyone can call 988. In New Mexico, we're going to have crisis system for children and crisis system for adults. 80% of the calls go to our local New Mexico crisis system access line. So NMCAL is our 988 call system. And 20% of those calls go, 20% of all the calls that come in go to a veteran line, because we do have a lot of veterans in our state. And we also have Spanish speakers, and Spanish speakers also have their own crisis line. So that's why it says that 80%. In New Mexico, we have three systems in place. We have our local 988 crisis line. We also have a local Agora backup line. So any calls that 988 cannot take will go to our backup center. And in addition to that, we also have a national backup center. So if for some reason we're getting so many calls, inundated by calls, that we have our crisis line cannot take it, it goes to Agora, our backup line. If our backup line cannot take it, it'll go to a national crisis line. So there should be no time, no event where a crisis call is not taken. Persons with hearing challenges can also use NMCAL TTY, which is 855-227-5485. In terms of languages, almost everything is English and Spanish. The call centers are English and Spanish. They also have a translation service, which covers 250 additional languages. And I'm aware that Navajo is one of those languages, but that's the only other tribal language that I know that is translated currently. Text and chat are only available in English. And what happens when someone calls 988? So when you first call, there's a greeting. And that greeting takes place while the call is being rerouted to your local network. Now, one key thing to keep in mind is that all calls are rerouted based on your area code. That has brought some positives and some negatives with that. Part of why it's done through our area code is for privacy reasons. because behavioral health is different than emergency or health related reasons. And so just know that if for some reason in our state, we have a lot of folks with area codes outside of the 505 area code. And so just know that the calls are still de-escalated in whatever state that is, because this is a national program. If I have an area code from Arizona and I'm in New Mexico, my call, if I call, I will be rerouted to the Arizona crisis line. The crisis line will still de-escalate me. They will try to figure out what my situation is, try to meet my needs. And then when I get to the resource part of the call, I can then let them know that I'm in New Mexico, and they would then refer me to the resources in New Mexico, or they'll give me a number to call for New Mexico resources. So that's very important to note, because I know that happens in a lot of states. We don't change our phone numbers anymore. A trained counselor will answer your call, will again assess the situation, try to figure out what is upsetting you, understand the problem that's affecting you. They'll provide the support that they feel you need. That could be de-escalation, it could be motivational interviewing tools, it could be resources that you might need. So that's through the call. Through the text, you have to text talk to 988. And it works very similar to the call. They'll assess the situation, provide support and resources. And then what's a little bit different is the chatting. So chatting again is English only, and you have to go to the web page on the slide. So suicidepreventionlifeline.org/chat. And they do a little bit of a pre-survey to kind of assess what the needs are. And if for some reason, right now we don't have wait times because it's fairly new, but if for some reason there were wait times, you would get a little notice of, 2 minutes before someone connects with you. So I talked a little bit about privacy in general already. So most emergency call, or all emergency calls to 911 are based on geolocation, which is key and needed if an emergency happens. I'm not able to speak, or I'm not able to speak, but I have my phone. They can still find me, and we want that, right? That we want to be found in cases of emergency. But 988 works based on that area code, like I mentioned, and a big portion of that is privacy reasons. And so just know that, everyone, folks are aware of that, and we're trying to make the community aware of that as well. There have been some talks about moving 988 to geolocation, but only talks thus far. In terms of privacy, this is key. And I want to make sure I bring this up because just as we've heard really positive things about 988, there are a little bit of concerns. And so what I want to make sure you know is that all call centers at the national level, because this is the federal funded program, will be asking some questions. But if you are calling 988 and you're in a crisis and you don't want to or don't feel like sharing personal information, you don't have to. You will still be de-escalated. You will still receive the service. Now, again, SAMHSA does recognize the importance of privacy. And at the same time, we also recognize at the state level, the reasons for collecting some information. Now, what are some of the reasons why demographic information would be collected? One of that is to save lives. I mean, sometimes we need this information to either dispatch a mobile crisis team or to make sure that we can follow up with someone. The other one is to connect folks to resources and to ongoing support. And the third one, as I mentioned earlier, I am an evaluator, and so I see the need for data. But one of the biggest things is when we're assessing the data and we're evaluating the data and we're trying to assess whether or not a specific population might not be calling the service, for example, Let's say youth are not calling 988. We need to find out why, and we need to know that youth are the ones that are not calling. Or it might be an elder population. Maybe they're not aware of it. Maybe they're uncomfortable. We don't know what the reason might be. But in order to start targeting at offering the services, answering any questions, we kind of need to know that demographic information. So just kind of wanted to show both sides of that. These are some pictures of some of the presentations that have taken place in tribal communities. These are the in-person presentations when we're working on how to develop their own plan, who should be included. You'll see some law enforcement, some tribal officials, some program department folks really trying to get out there with the community, because this is their crisis system. It is going to be something that they implement in their community. Here we're working with Kiwa, and they identified a lot of their cultural components that would create a lot of limitations, including limitations going to certain areas of the community by females, or a certain specific time that folks cannot enter. So there's a lot of components to think about when we're developing a crisis system within a tribal community. Okay, and then lastly, I just have opening for some questions and some contact information in here. I do wanna share though that okay, good. I just wanted to make sure I had stopped the screen share. I do want to share that I'm also involved with information and on the mobile crisis teams at the state level, with crisis triage development at the state level. I'm also working on developing the Medicaid policies and billing manuals for mobile crisis teams, and also involved in the evaluation of the call center. So we will be getting data on the call center. We will also be getting data on the rate of pickup of those call centers. So just so that you know that there is evaluation along with all of this. So I just want to thank you all so much for the time to present. And again, mention that this entire process has been team effort, and extremely happy to talk to folks in general. And again, extremely happy that I've been paired with Steph and Ray and Kalinda and our entire team that is working on the Crisis Now system, and being able to depend on each other for a lot of the efforts that we're doing. So we don't have much time, but we can answer any questions that have come up so far.
If anybody has a question for these guys, please unmute yourself. And Steph, Cindy, and Ray, thank you so much for doing this. This was wonderful information.
I do have one comment to make. One of our major partners is online with us, Karen Arviso from the Crown Point Healthcare Facility, an IHS program. Her program covers, I was thinking about this earlier, her program probably covers about 5,000 square miles of Navajo country. And so I want to acknowledge Karen for her effort, her support, and her involvement with the things that we're doing. So yeah, Karen, for joining us.
Ray, I didn't know if you saw the question, but when do you plan to have training? Police officers from Crown Point are inquiring. Crown Point, sorry.
That's a great question. I see Ray's either frozen or I do have to mention that some of the presentations have taken place. There's been a lot of presentations taking place in Crown Point. And so far, depending on the type of presentation that they want, if they want the 1 hour presentation, and then they can just send me an email and we'll go out there. I currently have already presented to Kiowa, Santa Clara, Eastern Navajo, Navajo Tech University, Domestic Violence and Sexual Assault Task Force, Crown Point Community Resource Meeting, Crown Point Schools, Native American Academy, Community Academy, Hickory Apache. I mean, there's been so many, and really the community, as long as the community sends in an email request, we'll be able to get out there and do at least for the 1 hour presentations and the tribal presentations, you would reach out to me for marketing material overview information. You can reach out to Steph and Ray.
Thanks, Cindy. You'd mentioned at our previous webinar, there'd be training taking place in the Albuquerque area. Is this, this is what they were interested in. This is what she was saying in the chat.
There are 3 presenters currently, and Ray, maybe I'll let you talk about that in case you had a different answer for. You're on.
Let me look at Karen's question again.
Talked about previous webinar where you said training would take place in the Albuquerque area.
I believe that this is really the first opportunity we've had to do a webinar of this kind that involves Cindy's work and engaging communities, and also the outreach work that Steph and the team does. At a state level, Karen, you might want to really look at there's plans for a tribal meeting in October at Isleta, when a whole gamut of discussions will occur with tribes and state around the 988 system broadly. If we're given opportunity, I know we can make room to do webinars like this more locally, like in Albuquerque. So that's how I'll answer.
Okay, well, you have Cindy's contact information here, and to request a recorded presentation. Yeah, so we usually upload all of our recordings to our YouTube channel. And so you'll get a follow-up email that'll have the information in it where that is accessible. It usually takes a day or two to become uploaded, and then you'll have the presentations in a PDF format. So you have all the information you would need from today's presentation. And thank you for those of you who had to switch over from one room to the other. I'm not sure, technology isn't my friend sometimes. So today was one of those days. And I appreciate you doing that and could get here and listen to this important work that these 3 are doing. So on behalf of our Native Center for Behavioral Health, I want to thank all of you for joining us, and feel free to reach out if you have any questions. I'll put my email in the chat real quick here. Thank you all.